Bulvinaka, and welcome to our Cancer Awareness Series. This is episode 2, and today we're shining a light on cervical cancer, one of the most preventable types of cancer affecting women today. I'm your host, Rosilla, and joining us today is our senior gynecologist here at Oceania Hospital's Dr. Pushpa. How are you this morning, ma'am?
I'm fine, thank you.
Okay. Dr. Pushpa is also a strong advocate for women's health, and she'll be here to help us understand how awareness, screening, and early action can truly save lives. So, Dr. Pushpa Vinaka, for being here. We're so glad to have you with us. So many women have heard about cervical cancer, but may not fully understand what it is. Could you explain what cervical cancer is and why it's such an important issue with women in Fiji and the Pacific?
Thank you for having me on the show, and it's my pleasure to talk about cervical cancer, because cervical cancer in Fiji and Pacific is one of the main cancers which takes women's life. Not only that, it really destroys a woman's quality of life, and it is a cancer which is totally preventable. So I will just tell you a bit about cervical cancer. Cervical cancer is caused by what we call human papilloma virus, and there are more than 100 subtypes of it, and it's mostly the 16 and the 18 which cause most of the cervical cancer, and the other 25% is caused by the other subtypes. Now, the importance of knowing this is that if women come for regular checkups and if they have their pap smears done, it can be picked up much earlier. So cervical cancer is one of the cancers that no women should suffer from, because it can be through screening, you can pick it up earlier and you can treat it earlier. And it is one of the most devastating cancers for women, I must say, because in later stages, this cancer can eat through your bladder, and it can eat through your rectum, where the place where we pass our feces. So the woman's quality of life is really not very nice, and women do suffer not only from the cancer, but the smell, and a lot of time they get ostracized from their families, and they have to spend their last days alone, which is really very sad.
Thank you. So you mentioned pap smears and HPV vaccinations. We often hear that cervical cancer is one of the most preventable types of cancer. So what role does pap smear and HPV vaccinations play in prevention, and how often should women be getting screened?
We know that from this HPV vaccination, it does protect. Our girls, there was programs rolled out in Fiji, and it will help protect our girls from this HPV infection and later on leading to cervical cancer. So the thing is, you asked me a very nice question, which, any woman listening out there, they should make their way to health facilities or, come to Oceania Hospital, because the pap smear screening that we do here, it not only picks up abnormal cytological cells, but it also, you will know whether you have HPV infection or not. And if you do have HPV infection, a lot of time with good immunity, it can get cleared away. But if it remains persistent, then your gynecologist or whoever is attending to you will advise you to undergo colposcopy and biopsy. And even if you show abnormal cells, depending, because this HPV virus, what it does, it affects what we call the transformation zone of the cervix, and it starts changing the cells. And with time, if nothing is done, then this same dysplastic changes, it can change into cancer. And women should know that if they have stage 1A1 cervical cancer, it's totally microscopic. So They may not have any symptoms, they may not even know they have cancer. And only when it becomes stage 1B1 will you be able to see a lesion on the cervix. And some women think that, to have cervical cancer, you need to have post-coital bleeding and things like that. But these things all come much later. So it is very important for women to come for their checkup. Like we are talking about cervix, and people who are listening to us, they may wonder what is the cervix. It's part of the baby bag. I'll just use the word baby bag, and we call it the mouth of the baby bag. So it is very easily seen. Like when we examine a patient, we can actually look at their cervix. And to do a pap smear, it's not a painful process. Sometimes women come to me and they are expecting it to be painful. Let me tell you, it's not a painful process at all. It may be just discomfortable. And here in Oceania also, we do it in a very private environment. And the woman has all the privacy that she wants and whatever makes her comfortable. And lately also here, the speculums we are using is not metal speculums, which, can make the patient feel uncomfortable. We actually using plastic ones. And most of the women's, they feel much more comfortable with these plastic speculums. And even when pap smear is done and finished, then they will be asking me, but doctor, we didn't feel any pain. So doing a pap smear is not painful. So please have your pap smear done. The other question you asked me is, how often should we do pap smears? So pap smears is normally recommended for people in their sexual age group, say you are 25, at least if you are 30, you should have had a pap smear done. But if you had your sexual life starting much earlier, then have it done by 25. 30 say, and you could do your pap smear. Nowadays the pap smear results which we get with the cytological cells normal and no HPV anything, if you fall in the low risk category, that means you don't have a family history of cervical cancer, you don't smoke, you don't have a risky sexual behavior, then you could do it every 5 years till you are 65 or even 70. But if you have a risky behavior, and then you'll have to go by the advice which is given by your doctor, and it will also depend on what the pap smear findings come back as, and then the gynecologist or your doctor will advise you when to do your next pap smear, and I think it's good to go by that.
Thank you. So I think a lot of the women have a stigma of fear when it comes to pap smear and all those checks, so they might feel shy or scared. What would you say to those who are hesitant, and how can families and communities help make it easier for women to be checked?
That's a very wonderful question, because you know why? I think we always come every year and every forum, we're talking about cervical cancers, we are talking about women suffering from cervical cancers, and we're saying it's just on the increase. And the thing is, it's a reality that women, they don't come forward to have their pap smears done. So, some of the things, probably the women are very busy, and most of the time the women, they spend thinking of their families, thinking of other people rather than of themselves. So I think it's time has come for women to take ownership of their health. If you don't want to do it for yourself, do it for your children, because a lot of these women with cervical cancer are quite young. Some are even in their 30s, some are in their 40s. So they have the whole life ahead of them. And you have to understand that this cancer was totally avoidable, totally preventable. So you didn't have to suffer from this cancer. And women do feel shy, or like they feel they will be exposed. So I think it's not only the women, even the medical workers, everything, they have to go and tell the woman, we will treat you with much dignity, with much respect, and you'll have all your privacy. So please do not be scared to come forward. And like I said, it is not painful procedure at all to do screening for cervical cancer. And lately we are trying to introduce self-swab testing system for HPV virus, where the woman herself can insert the swab, twirl it around, and then we can check her whether she has HPV virus or not, the virus which causes the cervical cancer. So I would like to say to the woman, please make your way to Oceania Hospital, because I know you will be treated very well. And please check with yourself if you have had your pap smear screening and when was it last done, and do not be afraid to come forward. But not only women, I would encourage men who have mothers, who have sisters, who have girlfriends, who have wives. They also should encourage the woman who is with them or who is around them to make sure that they have had their regular pap smears done, and so that they do not end up with the cervical cancer. And maybe you have some ideas of how we can get women to come. But what I feel is women basically are not selfish. They are concentrating on their children and they are concentrating on their family. So if you don't want to do it for yourself, do it for your family, do it for your children. And of course, do it for yourself also. And you have to take out time from your busy schedule and lots of things to do. And the ownership has to come from women. And it's very important for us to go out there and say to women, do not be afraid to come forward. I think it's a lot of time also fear. So that's what I'm trying to say is pap smear, having a pap smear done is not painful. It is not something like it's a big thing. You can come talk to your doctor and have it done, and you'll be surprised that you didn't feel any pain, but you came to know, if anything was normal or not normal.
Right. So finally, as we mark Cancer Awareness Month, what message of hope would you like to share with women who may be worried about their health, and what can we all do to support cervical cancer awareness in our communication?
Yeah, this is, quite a big question. So we have been trying to put the onus on the patients themselves, but it is more of I would say a socio-corporate responsibility. It is the responsibility of organizations who employ women to sort of assist their women to make sure that they all had a pap smear test done, and to encourage them to have a pap smear test done. And also, if other organizations want to assist, it's like, suppose there are women in the villages, it's very easy to say, come forward, do the pap smear. But if they have transport issues, to provide transportation, or even like medical healthcare workers, to go out to do camping, like in the rural areas, to try and give this service to as many women as possible. And lately I heard from one of my colleagues, she said the government is trying to help because now that they have instituted the Great Council of Chiefs, the chiefs in the villages are trying to encourage the men and the women to come forward and have your screening done. Because one of the strongest messages is that early detection saves lives. And it will not save life of only one woman. The woman is knitted with her children, with her family, with a larger community. So it will be a win-win situation for all. But I think it's everyone's responsibility also. Though we were trying to put for the women to come forward, we have to all combine and just see what part we can play, and to encourage women to come forward and have their screening test done. And in this way, we will one day, hopefully, that Fiji will be free, or the cervical cancer rates will be really down.
Thank you. So, with Dr. Pushpa for
Vinaka.
those powerful insights and reminders that you've shared with us today. To our viewers, please remember, cervical cancer is preventable. Get screened, talk about it, and encourage other women to do so. Thank you for tuning in to our Cancer Awareness series. Please don't forget to like, follow, and subscribe. Stay healthy, stay informed, and until next time, Vinaka.